Welcome to our monthly workshop at the University of Kentucky, offered for our UK working parents. And this month, we're going to be talking about parenting a child with autism spectrum disorder and just basically strategies for how to support your child if they have autism. So, our speaker today is Dr. Megan Carter, and thank you so much for being with us.
No problem. Again, my name's Megan Carter, and today I'm going to be talking about, I'm a pediatric nurse practitioner, and I'm going to be talking about parenting a child with an autism spectrum disorder. Okay. In terms of financial disclosures, I don't have any financial disclosures other than the fact that I work as part of the Division of Developmental Pediatrics here at UK. So, what I'm going to kind of talk about today is I'm going to kind of go through different things that may be important to know in terms of parenting a child with autism. I'm going to talk briefly about some things you may run into in the education setting, and then we'll kind of talk about life skills or difficulties that kids with autism may experience in their life, and kind of some ways to kind of troubleshoot that or things to think about as a parent. And then at the end, I'm going to kind of go through a couple of medical tidbits, but I'm going to try and not make it as medical as I did last year. So the first thing that I was going to kind of cover in terms of educational tidbits that parents may need to know is IDEA, so the Individuals with Disabilities Education Act. This was passed in 1975. And the aim of IDEA was to make sure that children with disabilities' rights are preserved, and this includes parents' rights as well. And then I kind of gave you the direct quote from IDEA. It's to ensure that all children with disabilities have available to them education, also known as FAPE, that emphasizes special education and related services designed to meet their unique needs and prepare them for further education, employment, and independent living. And it's supposed to be in the least restrictive environment. IDEA provides states and local educational supports to help children with disabilities to be able to access supports in the school setting. And it also helps with coordination with early intervention services. In Kentucky, the early intervention system is First Steps. And First Steps traditionally provides, and I apologize, I'm kind of losing my voice a little bit because of my allergies, so I may stop here in a minute to take a drink of water. The First Steps in Kentucky provide services such as physical therapy, speech therapy, occupational therapy, and developmental interventionist services to children from birth to age 3. And typically, if a child is still having difficulties in any of those areas, or First Steps has identified them as having a developmental delay, when they approach age 3, First Steps usually coordinates with that child's local school district to help develop a plan for early entrance into preschool after age 3. So hopefully those services continue for the child. IDEA also helps provide resources for parents and educators in the school setting to support the kids. And then it also provides assessment of efforts to assist children with disabilities in the school setting. And the assessment part is really important to make sure that the supports and goals that are in place are helping the child improve academically and developmentally. So I kind of slipped this slide in here. I talked about it a little bit last year, but when we think about an educational and a medical diagnosis, and for our purposes today, we're talking about autism. You can get a medical diagnosis of autism in the medical setting and an educational diagnosis of autism in the school setting. Sometimes these diagnoses don't translate from one setting to another. I would say in a lot of school districts in Kentucky, if I give a child a medical diagnosis of autism, the school district is pretty good about considering some of the testing that we've done in the medical setting and kind of considering that when they're assessing the child. But it's important to realize that if you've gotten a child that has a medical diagnosis of autism, you still have to go through the process in the school district of the school assessing them and deciding, are the symptoms that the child is having in school, are these impairing for them in the school setting? Is it impairing their ability to learn and function in the school setting? Because we have had some kids before that have got a medical diagnosis from us, but then they haven't qualified in the school setting because they're not necessarily having a lot of difficulty in school. So what we encourage families to do is, just kind of make sure that you're continuing to talk to your school district in case your child does start running into any issues in school. You can always ask for a reassessment, and then making sure you're getting outpatient therapies to kind of support your child if something like this were to happen. Other educational tidbits: when your child does go through an assessment at school, usually there's a team of people evaluating your child to give them a school diagnosis of autism or another category of disability under an IEP. And so usually there's a school psychologist involved. There could be other therapists or other professionals that are doing observations. But when the testing is complete, it's kind of all the testing findings are put into something that's called an integrated report. And it lists the testing and observations the school district completed that's taken into account to help develop a plan for the student in the school setting. And it can list the psychological testing, so like autism testing, IQ testing, developmental testing. It can list assessments done by other school therapists, like a physical, occupational, or speech therapist. And then a lot of times we see some other assessments thrown in there, especially in like my preschoolers that have an IEP or an integrated report. I'm sorry. I'm getting ahead of myself. They have their vision and hearing screens also included as part of their integrated report. So once that integrated report is completed, it helps the school district officials kind of recognize areas in which a child may be having difficulty. And I would say also it's important to note at the end of the integrated report, it will give like a determination that will say like this child qualifies for an educational diagnosis of autism. And so then they take that determination and they help develop an IEP or an individualized education plan under a diagnosis of autism. And your IEP lists the start and end dates of when the plan is going to be implemented. It usually is for 1 year in duration. And sometimes you'll see in the IEP a summary of testing that the school completed or updated information. Sometimes the term they use is present levels. And so schools typically do a big like psychoeducational evaluation on a child every 3 years. And then in between those years, they kind of do some smaller assessments to kind of see if the child's progressing in certain skills. And so that's kind of what present levels means. It's kind of the progress they've made in between the times of the big testing, if that makes sense. The IEP lists the goals for your child that the school district is going to be working on, and it lists the supplementary aids and supports that are going to be used to support those goals. And I didn't put this on here, but you'll also see if they're going to get things like speech and occupational therapy in school. You'll see how often they're going to get those services and what setting those services are going to be in. So under IDEA, there are certain disability categories that qualify for an IEP. And so I kind of wanted to list those out there so you guys can be aware of what they are. In parentheses, in italics, the Kentucky Department of Education uses a little bit different language sometimes than what you'll see kind of on national websites that are talking about disability categories for an IEP. So I kind of put this on here just to make sure you guys are aware that there's a little bit of different terminology sometimes at the state level. So the disability categories for an IEP, there's autism spectrum disorder or autism as the school district will use here. Emotional disturbance or emotional behavioral disability, intellectual disability, and Kentucky kind of splits this into mild and functional mental disability. Multiple disabilities, other health impairment, speech and language impairment, specific learning disability, developmental delay. That's a common one I see kind of in our preschoolers where we're concerned that they may have autism, but they haven't yet been assessed fully. Other disability categories for an IEP also include deaf blindness, deafness, hearing impairment, orthopedic impairment, and traumatic brain injury. So an IEP is a lot of kids with autism will qualify for an IEP, but I have some kids that may not need as much help and as many concrete goals in the classroom because they're being academic. They're doing well academically and developmentally in the school setting. So some kids will have what's called a 504, and a 504 is a little bit different than an IEP. It has a broader definition than that used under IDEA. And in order to meet eligibility criteria for a 504 plan, you have to have a physical or mental impairment that substantially limits one or more major life activities, have a record of such an impairment, or be regarded as having such an impairment. A 504 plan referral for evaluation can be started by anyone, school district officials, or a parent. They can use various information sources, so like outside therapy documents, if you have any. And then it often needs a medical provider to fill out a form listing how the impairment affects the child and their ability to learn. So often I have to fill out a form saying like, I've diagnosed this child with this condition, and because they have this, it could impact their ability to learn in this way. Usually 504 supports are provided in the regular classroom setting to help a child be successful, but it's just not as comprehensive as an IEP. And I do have some kids with autism that haven't yet gone through the evaluation process that sometimes are getting 504 supports at school, but we're kind of finding out that they need more help. And so that's why they're undergoing an assessment with our division. So some helpful websites that I kind of wanted you to be aware of if you're looking to learn more about an IEP and the supports that are available. This document, the IEP one that's blue, is the guidance for an IEP development from the Kentucky Department of Education. And it's a really good general guide that kind of goes over the things they think about when they're developing an IEP, and talks about different categories and things and how their assessments work and how often they happen. So it's a really good document to kind of look at to kind of learn more about the process. And then this IEP lesson plan and development handbook is also available, I think, on the same page. And it talks about some of the supplementary aids and supports that you could request to have as part of your child's IEP that might help support them in the classroom setting. And then Kentucky SPIN is a great resource that it's an advocacy and educational organization in Kentucky that really kind of can help parents advocate for their kids with autism. So it's a great resource as well. So now I'm going to kind of talk, we're going to kind of switch gears a little bit, and I'm going to talk about life skills. So I'm going to kind of talk about there are different areas in certain life skills that kids with autism sometimes have difficulty with. And I think some of these that I've kind of picked out in particular sometimes are particularly stressful for parents. So I kind of wanted to talk about things to think about as a parent and when you're approaching helping your child with things that they may be struggling with. So communication. Communication, I think there's 3 different aspects of communication skills that children with autism may or may not have difficulty with. So when we think about communication, we usually think about 3 things. We think about their receptive language, and a lot of our kids with autism do have delays in their receptive language. So this could be, are they understanding directions that people are asking them? Are they understanding instructions? How are they processing kind of the language that they're hearing from other people? A lot of our kids with autism have difficulty with their expressive language, so their ability to communicate with others and let other people know what they want, and kind of their ability to converse with people about various things. Some of our kids with autism also have difficulty with language pragmatics. So these are like the rules of language, and understanding that language can be used for various purposes and that it can be modified to certain situations or persons. So thinking about communication, it's important for parents to kind of, think about your child and determine what communication strategy that your child may gravitate towards, and then kind of foster that communication strategy in conjunction with your speech therapist going forward. Because, if you find out that your child seems to do a good job of using signs and gestures better than verbal speech, you want to be able to encourage them to communicate and advance in those skills. I'm not saying that, if your child is primarily using signs or gestures, they won't go on to using language, but we certainly want to encourage them to be able to communicate independently with us, to let us know what they want and need. So kids with autism can use verbal speech. Some of them are really good at using signs and gestures like body language. And then other kids seem to gravitate towards more augmentative and alternative communication devices, or AAC devices. And so it's just important to kind of work in conjunction with your speech therapist to kind of figure out, what kind of communication strategy does your child prefer to use more than most, and kind of fostering that. And if you'll note going forward on my presentation, under technology, you see these 3 little information guides. I've kind of taken snippets off of Autism Speaks. They have some really good information by topic, and they're little guides that kind of talk about a variety of different topics that may or may not impact children or adults with autism. And they're just kind of good ways to get started learning about different things that may or may not impact your child. And it's kind of a good starting place. So I kind of put their technology guides on here when talking about AAC devices, because they kind of have some on there about getting started using one, or tips for using one. So those are just some good things to be aware of, good resources to be aware of. So in continuing talking about some of our life skills, I think a big stressor for a lot of children and parents with autism is feeding. We know that 75% of kids with autism have feeding concerns. And when we think about feeding, it's important for parents to consider different things that may impact their child's feeding difficulties, and kind of figure out if there are certain things that, sensory issues your child may be running into, or difficulty, dealing or chewing, or dealing with certain medical issues that may go along with eating. So it's important to know that a lot of kids with autism have sensory issues with food. They may not like the way that the food tastes. They may not like the way it the way it feels on their hands, or on their lips, or in their mouth. They may not like the way the food smells, or they may just have a problem with how the food looks, and they may not want to eat it. It's also important to, one of the questions I always ask when I'm talking to parents of children with autism is, I ask, how are they doing with their oral motor function? Are they having any difficulties chewing that food? Or are they having any issues with motor planning? Once they get the food in their mouth, do they kind of know how to chew it up and move their food around in their mouth? Or do I find them like chewing it a little and then pocketing it on one side, because they're not really sure what to do with it next, or how to continue that process of, chewing up your food and being able to swallow it. So those are just some things to kind of consider when you think about feeding issues with your child. Another thing to kind of think about is when we're thinking about food and kids with autism, some of our kids with autism have some fine motor delays. So they may have difficulty eating certain kinds of foods because they have difficulty using the utensils that are needed for those kinds of foods. So if your child is having difficulty with that, it's important to kind of work with an occupational therapist to kind of work on those fine motor skills to ensure that your child is successful in trying those new foods that may require use of utensils. It's also important to kind of watch for medical feeding issues or concerns. We have some kids that do have really restricted diets, so sometimes we run into things like vitamin deficiencies. And then we've also got some kids that, do have certain intolerances to certain things. I've had some kids before that have been lactose intolerant, or had a gluten intolerance. And so we kind of have to modify their diet to make sure that they feel well enough to eat. Constipation is also a big issue in kiddos with autism, sometimes because of their restricted diet. And so it's important that we treat the constipation so that they feel like eating, because if you're, really constipated, you may not feel like eating. And then sometimes there are some behavioral concerns that go along with feeding. Some of our kids have difficulty sitting down for a mealtime or attending to meal times, and that's just something that's going to come with time. So it's important if your child has issues with feeding, make sure that you're working with a good feeding therapist as treatment. This can generally be a speech or an occupational therapist, depending on what the needs of the child are. A lot of times, occupational therapists will do a lot of work on the sensory aspect of feeding, and sometimes the feeding therapist will work on more of the oral motor issues. And I always recommend, if you can find a multivitamin that your child likes, I would recommend one just in case they do have a restricted diet. You're making sure they get all the vitamins and nutrients that they need. So the next thing we're going to kind of talk about is toileting. I feel like toileting is also kind of a big stressor sometimes for kiddos and parents. And so when you think of toileting is a larger skill that we're asking some of our kids to master. And when you think about potty training, it's a combination of a lot of things. And so kids first have to make the connection that, when their diaper's wet, it means they've used the bathroom. And so some of our kids, it takes them a little while to make the connection. And then once they've made the connection, they have to, if you think about the steps in potty training, they have to feel the urge to use the restroom before they've gone. They have to know to communicate that they have to go prior to going. They have to know where to go to the bathroom. They don't have to know how to use the potty. They have to know how to clean themselves after toileting. And, some of our kids with autism, they do have those fine motor delays. So they may have difficulty unbuttoning or unzipping their pants or getting their pants or their underwear down before they use the bathroom. So what I kind of tell parents is to kind of make sure you're being patient with your child. Sometimes it's good to break potty training down into smaller steps and then kind of work on adding more steps once they've mastered some of the smaller steps, and then putting them together, because it's a lot of steps to remember. And then, as I kind of mentioned on their last slide, if we're having issues like constipation, it's important to treat them. Some of our kids with autism do have significant issues with constipation. And so it's important to treat the constipation, because you don't want them to get in a negative kind of feedback loop where, they're withholding their stool until it's really big and hard. And then they have to finally go to the bathroom. And then when they do use the bathroom, it's painful. So then they're afraid to use the potty and they withhold their stool more. And then, so it just kind of is a vicious cycle. So it's really important to treat that constipation. And then in terms of professionals that you can work with on potty training, you can work with an occupational or an ABA therapist on these skills. Sleep, I feel like, is also a stressor for a lot of parents of kids with autism. We know that 50 to 80% of children with autism do have difficulty falling asleep and staying asleep. You think that sleep problems in children with autism may be due to differences in how melatonin is metabolized, differences in the brain that are important for sleep, and differences in understanding of social expectations regarding sleep. So it could be a variety of factors. It's important to kind of rule out medical conditions that may be impacting sleep first. It may be important to talk to your pediatrician if your child has restless sleep patterns or like restless leg movements, to get their ferritin and iron levels checked, because this can often be a cause of restless sleep patterns. If your child's snoring loudly or is making like gasping noises while they're sleeping, it would be important to be for you to seek out a referral to an ENT, because there may be concerns for like obstructive sleep apnea or something, like enlarged tonsils or adenoids that may need to be taken out. When we think of behavioral diagnoses or medical diagnoses that may go along with sleep, if your child has a comorbid condition like anxiety, if it's untreated, it could be affecting their sleep patterns because they're anxious about falling to sleep, or they're anxious about something that happened during the day, and that's keeping them from falling asleep well. There are sometimes some genetic conditions that go along with autism that make it a little bit more difficult for some kids to regulate their sleep patterns. And for the sake of brevity, I'm not going to go into those, but sometimes if we've tried a lot of different behavioral strategies and your child has a genetic condition that goes along with their autism that does make sleep a little bit more difficult, oftentimes we'll recommend you seek out care through like a psychiatric provider for sleep medications. And it's also important to remember that many sleep problems are learned behaviors or can be related to like an environment. So, it's good to have appropriate behavioral expectations for your child. Make sure they have a set bedtime, generally the same bedtime routine, and they sleep in their own bed if possible. You can use things like noise machines, storytime machines to help your child fall asleep. And it's really important to be mindful of screen time. Try and turn those screens off a couple of hours before bedtime, because we do know that, the blue light from those screens tends to wake our brains up and make it more difficult for us to go to sleep. So one thing that I wanted to throw in here was a little bit of discussion of safety. Some of our kids with autism do have a little bit of difficulty understanding safety concepts. So some of our kids are a risk for elopement. They're at a higher risk of having accidents and possible ingestions of items. So it's important to have a good safety plan, in different settings, especially in the home setting. If your child is a risk for elopement, you can request an elopement plan be part of their IEP in school, so that you're making sure that schools has a plan for when your child changes classrooms or goes out to recess. Just making sure someone is with your child and aware of them at all times to prevent elopement. It's also important for parents to have an elopement plan at home and in public if your child is an elopement risk. Angel Sense is a technology that has been out for a few years, and it's GPS tracking technology for that can provide like alerts on your phone. If your child were to elope, you'd be able to kind of figure out where they were. A lot of families that I've noticed recently are using, like, they're buying their child like something like an Apple Watch or some other kind of tracker that their child likes wearing, and that way they're kind of able to track their movements. It's also important in the home setting to, if your child is an elopement risk, think about window or door alarms, just so you would know if your child was leaving the house, and be mindful of outdoor hazards, like if your neighbor has a pool or you live close to a really busy road. I encourage all my parents at the end of when I talk to them to ensure to see if when their child gets older and is an appropriate age, think about some swim lessons for your child. Just if they are attracted to water, if they were to get out of your sight and get into a pool, I would want to make sure that they were able to swim and get out on their own. And also, it's important to make sure as a parent, you make sure you have things like if your child does put items in their mouth that aren't food, it's important to put lots of small items away and out of their reach. So things like medications, batteries, things like coins, just make sure they're put away and in a safe place. So I briefly wanted to talk about transition to adulthood. So, because this is a big step for parents and children with autism to kind of start thinking about next steps, like in planning for the future. So I started talking to some of my parents of my school age children. When we're in fourth, fifth, sixth grade, kind of start paying attention to, what activities is your child really interested in? Are they doing any skills that they enjoy or are really proficient in doing? Because if you can kind of pick out a couple of those skills that they're really good at, that kind of lets you know, like, and give you some ideas about skills to hone in on in the future, things that may be really important for particular kinds of jobs, or if they're going to go on to college, things like that. So in middle school, the school district is going to start coming up with a transition plan for your child to kind of prepare them for high school. But in the medical setting, we kind of start around 12 to 14 years, talking to parents about, what's the plan? Do you guys have a plan for when your child ages out of their pediatrician's office? Who's going to take over their care in terms of an adult doctor, adult primary care doctor? And if they need medication management, who's going to manage their medications into adulthood? Like it's important to find a local psychiatrist. If the parent or child has not yet applied for SSI or the Michelle P. waiver, we usually encourage this around that time. And then I put extracurricular activities on here just because it's important to have a hobby you enjoy as a well-rounded adult. So I encourage parents to get their kids with autism involved in certain extracurricular activities or, activities in general that they enjoy. So, because these may be important because we could get, they allow your child to have access to certain clubs or activities with their peers and could set them up to build like lifelong friendships. I know in like late elementary school, middle school, and high school, there's a lot of clubs that are available in the school setting. And there's even some clubs and extracurricular activities in the college setting that may be accessible for them based on what their special interests are. I put on here, there's at Western Kentucky University in Kentucky has the Kelly Autism Program. It's for students that are seeking degrees at Western Kentucky University that have been diagnosed with autism. And this program provides lots of additional mentoring, counseling support, weekly advisor meetings, and private rooms for college students with autism. And it just really provides lots of good wraparound support. So if you have a child with autism that you're thinking college is on the horizon for them, Western has this really great program that's out there and available. That's good to know about. Some additional resources in terms of national resources. There's the National Resources and Support Groups, there's the Autism Society of America, Autism Speaks, Autism Navigator, the state and local groups. The Autism Society of the Bluegrass is the parenting support group for Central Kentucky. And then in the Louisville area, there's Families for Effective Autism Treatment of Louisville, or FEAT is their name. And then I think Lexington has an Aaron's Hope chapter for Aaron's Hope for Friends. And this is a support group. It's mostly for adolescents and young adults with autism. And they have social outings. I think it's like once a month. And it's a great way to get people together, to meet new people and have fun. And I've had some patients of mine that have gotten involved in this group, and they've met some new friends as a result of it. So I think it's a great program. Other state and local resources in terms of school, there's the ARC of Kentucky that provides a lot of good information. Advocacy, there's Kentucky Spin that we kind of already touched on. And then I put a few extracurricular activities on here. It's in the Central Kentucky area. This is not a comprehensive list, but these are a few things that I wanted you all to know was out there. There's Top Soccer in Lexington. Justin's Place in Central Kentucky, Riding for Hope, are more like equine therapy programs. There's Toyota Children's Miracle League and A Chance to Dance. So a couple things I wanted to talk about from the medical perspective, just a few takeaways. I know that the larger academic medical centers like UK and U of L have long waiting lists for assessments of kids with autism. So I know that some families have chosen to go elsewhere to get their child diagnosed with autism, whether through a private psychologist or an outside facility. And in thinking about this, I just wanted to review a few medical tidbits that we often discuss with families after a diagnosis of autism, so that parents who receive their diagnosis elsewhere are aware of these recommendations, just in case this wasn't reviewed with you when a different professional kind of discussed your autism diagnosis, your child's autism diagnosis. So some medical recommendations that I usually talk about after diagnosis. One of the practice standards for developmental pediatrics is when a child is diagnosed with autism, we recommend referral to a pediatric genetics clinic for evaluation. We know that autism can be heritable. The rates of autism in siblings is higher than in the general population. And there are some genetic conditions that can sometimes co-occur with autism. For example, conditions like Fragile X syndrome, neurofibromatosis 1, Rett syndrome, tuberous sclerosis, and Timothy syndrome. And that is not a comprehensive list. But what I tell parents is, if you have a child with autism, it might be a good thing to go ahead and get it checked out with the genetics, with our genetics colleagues, just in case if we were to find something in a genetic abnormality. Parents may want to get tested to make sure that they don't have something that they can pass on, that they pass on to other children if they're deciding about expanding their family more. Because that would be an important to think about in terms of genetic counseling. I also tell parents, it would also be important to know, just in case your child, if they grew up and decided that they wanted to have a family and they knew that they had been diagnosed with an underlying genetic disorder, that might be something they would want to know about before they decide to have a family, or kind of discuss with their spouse in the future. We also know that children who have been diagnosed with autism are at a higher risk of developing seizures. So sometimes a neurology referral is warranted to kind of rule out seizure activity. We've kind of also touched on the fact that our kids with autism sometimes have issues with things like constipation. They can have intolerances to gluten and lactose and things like that. And so sometimes a referral to a pediatric GI specialist is warranted. And then if your child is putting things in their mouth that are non-food items, this medically is called pica. And there is a medical workup that your pediatrician can do for pica to check for things, medical conditions that can cause pica, such as iron deficiency anemia. And it's just important to rule those issues out, because those may be things that we can kind of correct with medications or supplements to our diet. Recommended therapies for autism can be a variety of things, from speech, occupational, feeding, physical therapy, ABA therapy, social skills, group or instruction. This is a social skills video that I'm going to kind of skip over right now for the sake of brevity, but we can watch it at the end if you guys want to. And these services can be done in the outpatient or the school setting. And in order to try and be a little bit more helpful, I kind of picked the counties in and around the Fayette County area and listed out a lot of different therapy providers that are out there, just so that you guys are aware. I'm not endorsing any of these specific agencies, but I just wanted parents to be aware of the kinds of things that were out there. So these are local speech, occupational, and physical therapy agencies in the Fayette County area. These are local speech, occupational, and physical therapy agencies in the Jessamine, Woodford, Scott, Madison, and Clark County areas. These are local ABA therapy agencies in the Fayette, Jessamine, and Scott County areas. And these are local ABA therapy agencies in the Clark, Woodford, and Madison counties. And the last thing that I kind of wanted to mention is sometimes there are some co-occurring neurodevelopmental, mental health, and behavioral disorders that sometimes co-occur with autism. And these disorders can be anything from like tic disorders, ADHD, anxiety. Sometimes as our kids approach adolescence, we see some concerns for mood disorders or aggressive behavior. So if your child does run into, if you think any of these neurodevelopmental, mental health, or behavioral disorders are co-occurring with your child's autism, it may be important to establish care with a psychiatrist going forward. So that is the end of my presentation. Oh gosh, hold on just a minute. You guys have any questions for me?
We have several questions in the chat. Are you able to see the chat?
Yes.
Okay.
Okay, I'm going to go back up and I'll answer some. Okay, I'm going to go down and go. I'm just making sure I see everything. Yes, the Michelle P. waiver can provide supports for your child going forward. There is a long waiting list. It's about 10 years long right now. That's why we are trying to get our kids on as early as possible. I think there is some, at the state level, they are looking at changing some of the waiver programs and some of the things that kind of go along with them to free up spots, but there generally aren't a lot of, they only have so many spots for the Michelle P. waiver. And so they generally only release a few a year, depending on funding. So that's why the waiting list is so long. SSI and Michelle P. waiver, I think I just went over. The Michelle P. waiver is a waiver program through the state of Kentucky. It's generally for kids with neurodevelopmental disorders like autism or intellectual disability. I do have some kids, I think, I've seen kids with Down syndrome on there as well. And SSI is supplemental Social Security income. So thank you for answering those questions already for me. Allegra, Margaret, I'm going to write down Allegro dance because I didn't know about that one. Thank you for that. Oh, and thank you for 250 more spots on the Michelle P. So that'll be good for a lot of our families. I think that was most of the questions in the chat. Anybody else have any other questions? I tried to make it a little bit more broad this year and less medically focused.
If you have a question and you'd like to unmute and just ask your question, you're welcome to do that.
The other thing I can do is I can also pull up the social skills video that I showed last year if you guys want to see it. But if you don't, I can put the link to the video in the chat.
I just thought I'd make a general statement. Actually, I'm getting ready to go into a meeting, and I'm on an advisory board with Fayette County Public Schools, and we're looking to create a mentorship program. So we'll be pairing families with families that have been through kind of transition points in school. So we're going to start with kind of that 5th grade to sixth grade transition, because I think for most of us, that's been kind of the hardest one, and really try to identify families that might need to be partnered with another family member that can give them advice on, you know, how to navigate that IEP, how to, you know, what to expect, because it is a very different experience. So I just thought I would mention that to everyone. And I'd also like to kind of put myself out there that I am a mother of a 13-year-old. I'm a coworker of yours. And if anybody else is going through that transition at this point, they just need somebody to reach out to and look for advice, especially as it relates to the school system. I'm happy to do that.
Thank you. That'll be a great program through the state of Kentucky or through the Fayette County School District.
May I answer the question for the driving?
Yes, sure. Go ahead, because I don't know the answer to this, and I'm going to write it down.
It's a family of college friend, and she has two boys with Asperger's, and then she has a daughter without. And the two boys, the oldest one is 20, and I've known them for a long time. Somehow I can connect with them. My brain just seems to work with them very well. And so since their father died and he was the one that had the Asperger's as an adult, he didn't know about it as a child. And so he's capable of driving. He drives like a grandfather. But it's more helping him to learn how to merge because that's a social interaction. But just driving around, he's fully capable and he's very intelligent and he's very, if you looked at him working at Fazoli's, you probably wouldn't even know. But I am capable of reaching him and explaining driving to him on his level, where his mother is not capable of doing that because she's just different way of thinking. It's not mad or upset or all. But I'm actually curious. The 3-year-old that lives next to me is more autistic than I'm used to. And he definitely has these social connection problems. How do you I just ignore the fact that when I say hi, he kind of ignores me, but how do you actually start engaging a child like that?
So I would say kind of think about it similarly to how you would engage another child who didn't have autism. Generally when I see a kid walking up and down the hallway, I kind of look at their clothing and see, oh my gosh, we're wearing a Disney princess shirt. Maybe we really like Disney princesses. So you may be able to approach that child kind of depending on what their interests are. Some of our kids with autism that aren't using a lot of words yet, sometimes they like a lot of sensory-based play. So, if you have any, if they're doing activities in the yard that, that you can kind of engage in them with, or kind of find out what they like to do, that's kind of a way to start engaging with them, just depending on, what their interests are. Does that make sense?
Yeah, I think he's just even more advanced than that. So,
Okay.
but yeah, I'm gonna let him continue growing. He's getting support help.
Okay.
His family's getting support help without any problem, and it is definitely helping. But I think he's probably just gonna need to eventually become verbal. It's a little bit easier.
Okay.
But yeah, thank you.
No problem. Does he have like an AAC at home or anything that helps him communicate with
I have
others?
no idea because I only see him outside.
Okay.
But he's just very high strung. It's hard to hold him still.
Okay.
There's a lot of eventually I think I will connect, but I think right now I'm just kind of like playing it as is.
Okay. Well, it's important to be patient, and so I would just encourage you to keep being patient, and then if you see an opportunity to kind of reach out to him, do so.
Yeah. And it does one other background info. I've helped at least 7 to 9 international grad students at UK learn how to drive. So helping an Asperger's person was just kind of in the same spectrum.
Mm-hmm. Okay.
Because they're coming from different countries and different rules and different thought process. So they have to do the background knowledge first.
Right. Um, someone just put something in the chat about Voc Rehab supporting people with disabilities that are learning to drive. I didn't even think about Voc Rehab. Thank you for bringing that up. Voc Rehab also, there are some opportunities once we get into, I think it's high school and we start thinking about a transition plan for after college. Voc Rehab can kind of help sometimes with supported placement as well when kids get out of school in terms of employment and job opportunities. So I don't have a sister with autism, but I have a sister with some developmental delays, and Voc Rehab helped us find a placement for her after she graduated high school, and she's been working successfully as an employee at this place since she graduated. So any other questions for me? Comments, concerns?
Do you have any advice in terms of the mental health support for a child?
Or for
Yes,
parents or the child?
for the, I guess both, but I was thinking for the child.
So, I think I'm going to kind of do both. So I think as a parent, it's good to set up a network of other parents of children with autism that you have difficulties, or that you, let me take that back, because I apologize. I'm losing my voice and I'm having trouble organizing my thoughts for a second. I think as a parent, it's a good idea to find a network of people who have children with similar diagnoses that you can kind of talk to about various things. This can be done through, like, you know, the Autism Society of the Blue Cross. You can go to meetings and meet people. But I think that's important because there are a lot of parents who have been through things similar to what you as a parent may be going through at a different time in their life. And so they may have some suggestions and strategies that may be actually very helpful for you at whatever point you're at in your child's life. In terms of mental health support for your child, it's important to kind of, you know, get them involved in different activities, see if we can kind of work on some of those connections with our peers and some of those social skills. Also find an activity that they kind of enjoy doing that can support their mental health. And then if we are running into things like, you know, we have comorbid ADHD or anxiety, it's important to discuss those things with your pediatrician or a psychiatrist, or if you're coming to our clinic, you're already an established patient here, you know, talking to this about with your medical provider, as we may need some, you know, medication interventions for things like ADHD and anxiety. And then it's also important, if your child, you know, needs support from a counselor, find a local counselor who's willing to kind of work with you guys and kind of work through some of those strategies that you may need to kind of help support your child from the perspective of if they're having difficulties with their ADHD or anxiety, or, you know, they just need somebody to kind of talk to about whatever's going on in school. So I don't know if that answered your question, but that would be my advice. I think there's a lot of supports out there. It's just kind of figuring out which supports are going to be the work for your child, because every child with autism is different. And I always tell some of my parents, I have tried one counselor and it didn't necessarily go well for them. And I say, well, you know, let's try somebody else, because, you know, sometimes certain counselors don't always work out for certain people. There may be personality differences or different approaches that your child would prefer to use that this counselor particularly didn't use. So that's just some suggestions that I have to kind of support parents and children